Hi everyone, it's me, and I am going to show you today how to give yourself a subcutaneous injection of octreotide. Um, yeah, uh, I am not a medical professional. You guys should not do this. This is just for your own edification about what I do every night to manage my disease. Um, anyways, so this is octreotide. It's comes in this little vial. You can see it says octreotide acetate on there, and it has a little snap top that you can just snap off like that. Um, and it has a little rubber stopper in it. And so what you do is you take a syringe. So I get these 27.5 gauge syringes. They come all wrapped up and they come with the needles attached. And you open it and it's sterilized. And then you take the cap off. And you just put the cap, or you put the needle directly into the cap, the little rubber stopper on it. And then you just start drawing it into the syringe. And so you always have to check the medication to make sure that it's clear, to make sure that it doesn't have any like particulates or crystals in there, because, well, that would be bad. So as you can maybe see, I don't know how great the quality is, but there's an air bubble right there. And those are really common, and they're really annoying to deal with. So I'm just gonna pull as much as I can into there, and now I'm gonna try to deal with the air bubble. And so what you just do is you flick it, and you flick it, and you flick it, and you flick it, and eventually the air bubble goes up. And then I can just push it out, and there's still some more medication in there. I have to get that in there. I always try to be really precise and try to get all of the medication that I can, because sometimes there's always a little bit left in the bottom of the syringe, and I always want to get the right dose. So today I did good. As you can see, I got over a milliliter in there. And so now what I'm going to do is I'm going to push on the stopper just gently, so you can see a little drop down there, and so that way I know that there's no air at the top. So now I'm going to give myself the injection. And I have 6 different injection sites. I have to rotate because, well, if you give yourself an injection in the same spot every night, you'll get scar tissue, and I already have actually pretty bad scar tissue, even though I rotate, just because I'm not very good at giving myself the injections, and there's not that much fat there and stuff. So tonight is the night for me to do my right arm. So I take the alcohol wipe and I wipe down my arm really well. And I'm wiping down like a really huge area because I don't know where exactly I'm going to inject it. Whoops. And I have to, find a place where there's a little bit of extra skin and fat. And I'm not just injecting directly into the muscle, because that's like really painful. It's kind of hard to do your arm injection yourself because you need one hand to like pinch up the skin, and you need the other hand to push in the stopper, and since it's on your arm, it's kind of awkward. So usually I have someone else help me, but there's no one else around tonight, just me, so I'm just going to try to do it myself. So if you can see, let me try to position a little bit better here. I'm sorry if I'm freaking any of you out. I realize that this is totally mundane to me, but not everyone has to do this to themselves every day. So if you want to stop watching, you can stop watching. I'm not insulted. Anyways, so I have this nice big like meaty thing of skin here, and I put the needle in, and I put it in at slight angle, about a 45-degree angle, and it went in pretty easy there, which I'm glad about. Sometimes it just won't go in, and I have to actually try to put it somewhere else because, the skin isn't tight enough or something. So now what I do, so now the needle's in, and now I pull back on the stopper a little bit, and the reason I do that is just to make sure that I didn't hit a vein. because that would be bad. Giving myself an intravenous injection instead of a subcutaneous injection, bad. So if I did hit a vein, I would be pulling back and there would be blood coming up, and there's no blood coming up. I've never had that happen. I don't really think it happens that often. So now I'm going to press down on the stopper and put the medication in. And here it goes. And it's pretty painful. There are ways of making it less painful. One way is to warm up the medication beforehand. It needs to be refrigerated, so warming it up to like body temperature makes it a little less painful going in. Another thing I do sometimes is I blow on where the needle is, and you know, sometimes that helps a little bit. The cool air, it's kind of distracting. On. Sometimes I count down from 10, which doesn't really help, but I don't know. It makes me feel like I'm doing something or something. So there, that's it. I'm done. Then I have to reshield the needle because I don't want it poking anyone else. I don't have any bloodborne diseases, but you know, you always need to make sure to be careful with that. I have a little bit of blood there. That's not that unusual for doing it in my arms because, like I said, I don't have that much fat there. So I have these cute little tiny baby Band-Aids and that my pharmacy gives me. And I just put that on there, and whenever you see me, I'm probably likely to have at least one Band-Aid, one of these little Band-Aids on somewhere. Anyways, the next thing to do is to properly dispose of the needle in your sharps container. And I'm not going to show you that because it's boring. But it's something that I always have to do, and then I have to go empty my sharps container. Eventually it gets full. And it's really stupid and annoying. None of the hospitals around me will take my sharps container because I guess there aren't enough people around here who need parenteral medication. So I have to go to needle exchange to hang out with all the drug addicts and give my needles. And they're always like, "Oh, do you need more needles?" And I'm like, "No, I get them. I have a prescription. I'm not a heroin addict." It can be kind of awkward sometimes, but everyone's really nice there. It's just another one of those things that is just you know, more stupid, like bureaucratic mess, and one of those things that just is just another hindrance of being sick. Anyways, that's it. I hope you guys enjoyed my little instructional video. I hope I didn't forget anything. Maybe I'll do more of these with other stuff at some point.